So Janice Sinoski is an associate professor of nursing at the University of Lynchburg in Lynchburg, Virginia. Born and raised in Canada, she graduated from a diploma nursing program in 1979, earned a Bachelor of Science in Nursing from Western University in London, Ontario in 1986, an MSN in 2011, and a doctorate in educational leadership with a focus in adult and continuing education from the American College of Education in 2020. Her specialties include critical care nursing, emergency nursing, simulation, clinical management, and research. Current certifications include CCRN, CEN, Certified Nurse Educator, CPI, and CHEP, alphabet soup. I don't know all of them. With over 40 years of experience in nursing and 10 years of teaching, Dr. Sinoski remains passionate about nursing ed. In addition to teaching, she serves on a board of managers of a local hospital and has recently completed a community-based research project in Lynchburg. All right, Janice, it is your turn. It's your show, and I will pop back up when you're at the 25-minute mark and have about 5 minutes to close, okay?
Okay, that's fine. Thank you. So good afternoon, and thank you for providing a platform to share research. My name is Janice Sinoski. As I said, I'm an associate professor of nursing at the University of Lynchburg. I will be sharing my research on the retention of experienced nurses. In January 2020, just before the pandemic, I completed my data collection. For research purposes, I defined an experienced nurse as a registered nurse with at least 20 years of hospital experience. My research provided me with a better understanding of the workplace challenges facing our seasoned nurses. So how did this study originate? Like many of you, I suffer from curiosity, that strong desire to know or discover why. When I was working as a charge nurse in the intensive care units, I often wondered why nurses leave bedside nursing. Over the past 42 years as a nurse, I saw nurses leave the ICUs to travel or to care for family or to return to school like I did. Often it was the oldest, most experienced nurses who stayed on the same unit and in the same hospital. Then I noticed older nurses were leaving about 10 years before retirement. And I started to wonder, well, why weren't they staying until retirement? What factors were impacting their decision to leave? So my research problem statement was born of that curiosity. The problem is experienced nurses are leaving the profession of nursing before reaching the age for retirement eligibility. Next slide, please. So my purpose statement became the purpose of this descriptive qualitative phenomenological study was to explore the lived experiences of nurses with at least 20 years of experience working in a hospital setting in Virginia. I chose this study format to explore the lived experiences of seasoned nurses working in the state of Virginia. I was attracted to a phenomenological study as a means of eliciting as much information as I could from the study participants. So much of a nurse's day is spent clicking boxes on an electronic health record that I wanted to give the nurses a chance to tell their stories with as much time as they needed or until data saturation was reached. So next slide, please. A bit of background. Society entrusts the profession of nursing to provide safe and competent nursing care to vulnerable populations of sick and at-risk patients. Professional nurses are the primary caregivers in the hospital setting. Experienced nurses are often the first to notice a change in the health status of hospitalized patients and intervene to prevent deterioration. Adequate staffing level of nurses with an expert blend of skills and experience are essential to optimize patient outcomes. Experienced registered nurses are valued for their assessment skills, clinical judgment, critical thinking, communication, and leadership skills. At the time of data collection, the current and projected nursing shortage in the US of 1.8 million nurses by the year of 2030 added to the urgency and significance of a research study exploring experienced nurse retention. With this research, an opportunity exists to identify current and evolving workplace challenges, which could prompt the development of retention strategies targeting the experienced nurse. Current nurse retention strategies may not address preventable causes of nurse attrition. So the scope of this research was to explore and identify workplace challenges that influence nurses' decisions about early retirement. The challenges of the workplace identified by this study provide opportunities to optimize workplace management. My literature review identified, next slide please. The literature review identified nurse retention as a relevant topic. Experienced nurses are essential in managing the complex nursing needs of our aging population. Qualitative studies emerged as an acceptable research methodology in both national and international studies about nurse retention. Multiple and varied factors play a role in sustaining an adequate nursing workforce. Additional research is essential to address a gap in the literature about experienced nurses' perceptions of workplace factors and how specific factors influence the nurse's decision to stay employed or seek early retirement. The literature review revealed multiple contributing factors that included generational diversity, a shortage of nurse educators, and the increasing influence of technology in healthcare work environment, which influence the organizational outcomes of employee engagement and nurse satisfaction at every stage in a nurse's career. I wondered if a research study to explore the workplace challenges of experienced nurses could provide new knowledge and insight to develop effective retention strategies specifically targeted for experienced nurses. Slide, please. My conceptual framework provided a visual representation of factors, processes, and outcomes. This was adapted from the nursing services delivery theory of Meyer and O'Brien-Pallas. The use of the nursing services delivery theory provided a foundation to understand the complexities and dynamics of nurse retention in healthcare organization in terms of system theory. That's what I was comfortable with. Human, financial, and material resources comprise the inputs of a healthcare organization. The inputs are acted upon by the organization's internal forces and external forces, which affect the outcomes of the organization. A shortage of nurses and an aging population in the US were identified as external forces impacting the system. The internal forces include working environment, working conditions, the level of support from management, and organizational subsystems. Workplace engagement, nurse retention, work efficiency, and quality patient care were key outcomes impacted by actions on the internal or from the internal and external forces. Next slide, please. So my 3 research questions guided this study. 1, what are the lived experiences of experienced nurses in a hospital setting influencing retirement before retirement eligibility? 2, what workplace factors do experienced nurses perceive as influencing retirement and retention? And last, how have workplace factors impacted experienced nurses' decision-making about leaving the profession before retirement eligibility? Next slide, please. The chart shows how the 3 research questions correlate to the 11 interview questions that were asked and the conceptual framework factors. Using this method, I was able to organize the data for analysis. I designed the interview question tool, which was then validated by a panel of 5 subject matter experts and accepted by the Institutional Review Board. All participants were asked the same 11 questions in the same order. Next slide, thank you. A descriptive, qualitative, phenomenological study design is an accepted and valued method in research in nursing. Next slide, please. A phenomenological method provides a voice to the participants and illuminates the complex workplace factors influencing early retirement. The target population of the study were registered nurses with at least 20 years experience and currently working in a hospital environment in the state of Virginia. A total of 15 face-to-face, semi-structured, in-depth interviews and 1 in-depth phone interview took place to collect data from the qualified participants. The participants met the study inclusion criteria and voluntarily consented to answer the 11 peer-reviewed questions during individualized audio-recorded interviews. Techniques to enhance validity and reliability were built into the design structure of the study, including member checking, data collection from multiple nurses representing 4 different hospital systems, using third-party transcription services and electronic journaling. Next slide, please. The analysis was accomplished by following Calaise's 7-step method of inductive reduction. Third-party transcription of the audio recordings provided verbatim narratives for analysis. Calaise's method provided a systematic means of reducing the volume of collected data from 120 significant statements to 23 cluster themes, and finally, 8 emergent themes. Each participant was sent her respective transcript for review and revisions. The final emergent themes were also distributed to the participants to ensure an accurate and complete representation of their common lived experiences. Transferability was achieved through strict adherence to the interview questions so the research method could be replicated. To mitigate personal bias, the practice of bracketing was used while keeping detailed notes in an electronic journal, thereby enhancing the dependability of the results. The electronic journal was also used to capture nonverbal observations that augmented the thematic discussions. Next slide, please. So let's look at some of the results here. 3 themes emerged that aligned with question 1, which was what are the lived experiences of experienced nurses in a hospital setting influencing retirement before retirement eligibility. A passion for nursing emerged as a significant theme and is a consistent finding in previous literature. 87.5% of the interviewed nurses viewed nursing as a calling or a duty from which they derive fulfillment, value, and for some, their identity, as reflected in this statement, which I'll share. A nurse is my core. It's what I am. It's hard to separate me from my career. It's one and the same. The second emergent theme of self-efficacy was voiced by 50% of the participants, described a sense of mastery with clinical skills that comes with veteran experience, including those assessment skills, clinical thinking, clinical judgment, and leadership that promote pride and fosters a desire to stay in the workplace. One participant described her mastery of skills by saying, I feel like I'm at the top of my game. I think that helped me stay in nursing for the greater good, to be able to hand over my tools and my knowledge to somebody who wanted to learn from me. That keeps me going. The third emergent theme centers on the significance of reward and recognition by peers, patients, and hospital management. Reward and recognition are key factors for influencing nurse retention, as described by 81.25% of the study participants. Employee satisfaction with rewards and recognition is a cornerstone in human resources management. You might be surprised to hear that money was not a major reward factor. One memorable quote is, we need to be recognized because if we are not, then people don't know what we do, and then we are considered disposable. 3 significant themes emerged from the second research question. What workplace factors do experienced nurses perceive as influencing retirement and retention? Generational diversity reflects the challenges experienced when 4 generations of nurses work together. 50% of the study participants commented on the intergenerational differences in the workplace, which the nurses perceived as an influential factor for retirement. The comments related to the perceived differences revolve around work ethic and expectations of reward for services to the organization. Comments included, the younger nurses are there for the moment and then they are moving up, as opposed to staying at the bedside and making changes. I'm sure it's management's ways of retaining the younger one, but it's a kick in the pants for people who were more mature and experienced. Participants saw incivility and bullying as a constant issue between generations of nurses. The second theme, physical decline, emerges out of narratives as over 50% of the study participants described the physical challenges and the emotional stresses of working 12-hour shifts and caring for heavier patients. The comments from the study participants are so powerful. I would like to share some comments. I think most of us can relate to these comments, including, I have to think before I kneel down now or squat down to look at the urine output on a urimeter or drainage from a chest tube. Just everything aches more. I have to be careful around all those cords so I don't trip. And I definitely need more light as well. 12-hour shifts, it's a long day. I'm exhausted by the end of the day. I like 8 hours, but my unit has switched to only 12-hour shifts. It's just a struggle for me physically. The third theme of technology fatigue reflects the experiences of the nurses as they cope with keeping up to date with learning new and advancing technologies meant to improve patient outcomes. 62% of the nurses expressed concern about taking time away from patient care for documentation. Comments included, I have to ask so many questions about the electronic health records. It's not intuitive. And I feel sometimes I'm taking more care of my computer than I am with my patients. I feel like we've gotten away from patient care, as if it's more about the computer than patient care. Some of the technology is difficult to navigate and time consuming, so I'm spending less time with my patients. Next slide, please. One of my participants described her thoughts on technological changes in nursing, and I want to share her powerful and poignant analogy. She says, if you have driven in the snow, you know that it can be beautiful. As it starts to snow, it's like being in a snow globe that's been shaken. There is a novelty to it. All of those technology changes that are coming to your windshield represent those snowflakes. Right now, all nurses are driving in a blizzard. The changes that are coming at us are so fast, we cannot keep up. But we can choose to stop and pull over until the snowflakes stop. But they're not going to stop. Right now, my windshield wiper is on full speed, but the changes are still coming. Often, these powerful comments were shared with strong emotions, anger, frustration, tears, captured by the audio recording. Next slide, please. 2 themes emerge from the narratives related to the third research question, which asks, how have workplace factors impacted experienced nurses' decision-making about leaving the profession before retirement eligibility? Intent to leave was the first emergent theme, and the concept refers to the level of contemplation or thought given to leaving the workplace or organization. Perceived financial security, poor health, and caring for family members were the main reasons for nurses to leave before the age of retirement. Several participants commented on feeling isolated, with one pointing out, I feel isolated because of my age. There are not many experienced nurses left. I feel like a dinosaur that's becoming extinct. Another commented, I feel the exclusion. I don't have anybody my age to work with, and to have that buddy and that camaraderie, that kept me going. Others think of what it would take for them to leave. And one commented, you know, there are rumors that they may do away with closed staffing, where we might have to be pulled to other units. And that would throw me into early retirement. My body is so worn out, I couldn't take that change. The last theme is one of moral distress. Moral distress describes the lived experience of frustration felt by the experienced nurses who are knowledgeable and trained to deliver excellent patient care, yet find themselves constrained by a combination of workplace factors such as staffing shortages, increased patient workloads, and the increased time necessary to complete documentation in the electronic health record. The nurses voiced a sense of frustration over the inability to provide safe care. And for many participants, they would rather leave the workforce than provide unsafe nursing care. The combination of workplace factors left 25% of the nurses concerned about their ability to continue to deliver safe nursing care to their patients. 50% of those nurses who voiced concern about patient safety were in the 45 to 54-year age range. The moral distress from the inability to deliver safe nursing care to patients significantly impacted the nurses' decision-making about leaving the profession before retirement eligibility. Another comment, if I am frustrated more often than not, and if I see my patients are not doing well and there's nothing I can do about it, then I will be gone. If the hospital management disregards patient care and decreased our staffing enough to where it's no longer safe, then I will go. Such powerful statements from our valuable, experienced nurses. Next slide, please. So my limitations of the study were few, but included a small sample size from the geographic location of Virginia, a short data collection time of 3 months, and possibly the investigator-participant relationship that limited response rate, because I too was a critical care nurse in 2 of the 4 hospitals. Next slide, please. So recommendations for leadership. The 8 emergent themes reflect the lived experiences of these 16 nurses working in hospitals in Virginia and offer insight into current and evolving workplace challenges facing nurses as of January 2020. The implications of the study findings are significant and relate to workplace challenges impacting nurse retention and attrition. Seasoned nurses in the 45 to 54-year-old range are experiencing moral distress related to workplace challenges. Moral distress impacts the nurse's decision to retire early or leave the nursing profession. Changes to the nursing practice to ensure safe staffing levels, a healthy work environment, and to accommodate generational diversity and adequate resources in light of increasing technology demands will be essential to address the patient safety concerns of our valued population of older and experienced nurses. With this research, an opportunity exists to develop retention strategies targeting experienced nurses and to share our findings and collaborate to find solutions. Next slide, please. Our implications for leaders. As a nurse educator and leader, sharing the study findings with nursing administration locally, nationally, internationally, through scholarly writing, additional research, and presentations will increase awareness of the nurses' shared concern for patient safety and for workplace factors affecting experienced nurse retention. Increasing awareness of significant workplace challenges may lead to evidence-based changes in nursing practice and policies that result in enhanced nurse retention. Enhanced retention of experienced nurses during the current and anticipated nursing shortage will promote safer delivery of patient care by nurses who are passionate about caring for the needs of our sick and vulnerable populations. More research needs to be done to determine adequate staffing ratios and meaningful support for experienced and new nurses, as well as research on developing targeted strategies to entice workers to remain in the workforce to the age of retirement eligibility. Further research is warranted to explore the theme of moral distress and the impact of moral distress on nursing retention. And closing thoughts, my research findings have been shared with the hospital recruiters at each of the 4 hospital systems in this study and have been sent to the Human Resources Department at the local hospitals for review. The pandemic has served to highlight workplace issues and provides a wealth of opportunities for future research on nurse retention. I would like to delve further into the theme of moral distress in nursing, as the last 2 years of dealing with the pandemic and staffing shortages have brought additional focus to the topic of moral distress. What surprised me most was that my little study echoed what was found across the US and abroad, but the pandemic has amplified those problems. Next slide, please. As a scholar, it's my responsibility, I feel, to share my research findings. I've been published both nationally and internationally. I hope my findings will encourage others to duplicate the research, especially after the pandemic, to see what has changed and how we can help retain more nurses. I thank you for your attention, and I'm happy to field any questions. Let me turn my camera on. I don't think I've had my camera on the whole time.
You haven't, but we were looking at your slides. That's okay.
Okay.
And you finished right on time. So we have about 5 minutes for questions. First, I want to say thank you for the phenomenology. My dissertation was using Heidegger's phenomenology. So when you started down that path, I'm like, oh, I get it. The lived experience. I lived that for how many years?
Yeah.
As a sample. But you had some things that did not surprise me. But at the same time, it's good to have them out there. You know, people need to talk to the nurses that have been there. Doesn't do us any good if they all leave.
Well, when I was listening to Dr. Beckett's talk yesterday, and she was talking about different team members, and I was talking about, well, maybe there could be a scribe, and maybe some of our older nurses would stay in if they had some assistance to be able to put in their technology and feel comfortable and competent that they could do that.
Mm-hmm. Oh, agreed. 100% agreed. But, you know, I don't know how we're going to get there with it. They don't want to pay as it is, right? And add another team member.
A scribe, I think, would be cheaper than a nurse. And I think someone who's been in nursing 45, 50 years, they can do the patient care. They have no problem with that. But it's that lack of confidence. And to tell you the truth, a lot of the electronic health records are not user-friendly. No.
Oh, and just when you get used to one, then they decide they're going to go to a new one or update it and change everything. Like, oh, come on, I knew how to use that one.
That's right. I've gone through 3 now with my students, and I find them challenging. Went through Epic, went through McKesson, and now on Cerner. And I still do the charting with my students, but I just find that I think, well, I knew where it was in the other system, but it takes me longer. And again, I feel like I'm nursing my computer rather than nursing my patient. So I can relate to those nurses who feel uncomfortable in that situation.
Oh, agreed. And it does take a little bit of finesse to figure it out and do it quickly and yet still do it, because that's the other thing. Are we catching everything? It's in so many different places. Not pull through. It's crazy. But and it's funny, the 3 systems you've worked on, yes, I've worked on all of those. And Cerner would have been my favorite, but it was my first. And so I think it really comes down to that. You know, what did you use first? What did you get really good with? And then they move you. Epic, I didn't like Epic. McKesson was different. I didn't mind it, but it really had a different feel than either Cerner or Epic.
Okay.
Does anyone else have questions, input for Janice? Wow, love crickets. And Janice, you're the one that usually adds something to the chat box, so I won't look for your add to the chat box this time.
Yeah.
But it very interesting, and I love the idea that I saw that you've got it updated, you've got it put on ProQuest.
So yes, it's on ProQuest. It's in an international journal. I figure if I get the information out there, then somebody will read it and may follow up. Any one of those themes that I wrote about that came as emergent themes, I think would be apt for doing further research.
Oh, absolutely. One of my classes is on group process, and we talk about how the generations all work together and what some of the stressors are based on 4 generations on the same unit, on the same floor at the same time. And it's very interesting to hear different perspectives of who gives each other the most issue.
Yeah. Some of the best experiences I've had with the younger nurses coming in is that I can help you with your critical thinking if you can help me with the technology. So it was a win-win for both of us.
Well, and and the Gen Zers are the ones that are really good at technology. They've grown up with it. So you're right. Yeah. If we can learn to balance with what their big positives are and what ours are, so that we can connect, it does work much better. But sometimes it's hard. They also don't have a whole lot of social skills, and some of those soft skills are lost in their arena. But,
right. Okay. Well, thank you.
Thank you.